Okay, well, thank you so much for joining us today, Dr. Solti. Dr. Magdolna Solti is with Compass Oncology. Dr. Solti specializes in medical oncology and hematology with advanced subspecialty training in breast cancer, cancer genetics, and clinical trials research. She maintains additional board certification in internal medicine and is director of the Compass Survivorship Program. And we're always just so happy when Dr. Solti can join us. And so just thank you so much for all you do. And I will hand it over to you.
Well, thanks so much, Thalia, for the nice introduction. Now, let me see. Do you see the slideshow from the beginning? How about that?
There you go.
Is it visible? All right. So my goal tonight is not to have like big comprehensive talk, but I come across a couple of interesting ideas and study results from the last year that I wanted to share with you, and mostly just share stories about how you can cope better, how you can manage these symptoms of the prior treatment a little bit better. So I want to start with my great-grandmother's Veronica's story. So Veronica lived to be 93 years old. And when she was in her 90s, and I was lucky enough that doesn't live very far from us, so I got to see her a lot. And I talked with her a lot at the end of her life, and she told me, you know, I have one big regret. When I was in my 70s, I was diagnosed with cataracts, and they offered me to do the cataract surgery. And I thought, oh, I'm not going to live long enough to get a benefit of that. And keep in mind that was in rural Hungary in the 1990s, but Veronica did live to be 20 plus more years. Wow. By the end, she could barely see, and that really impacted her quality of life. So the story and the message for you that, do you live with some regrets? Can you start working on that checklist? Can we help you give some ideas to down on that list? So here's what I planned for you for today. Let me see if I can advance that. All right, that's too fast. So I plan to touch on some common side effects that most likely most of you had been dealing or currently dealing with. Fatigue, sleep problems, the chemo brain part, the chronic pain syndrome, some back nerve damage, and some cool new ideas about what is these gut bacteria doing with cancer and cancer treatment. Some new research about how about the heart from after cancer treatment, and anxiety and some coping. And yes, this picture, this notebook I just recently got from my patients, so no, I'm not talking about hair loss. Start with fatigue. This is the official definition of fatigue. So it's basically this persistent sense of not just physical, but emotional, cognitive tiredness that related to either the cancer itself or its treatment, but it's not proportional for the physical activity, and it interferes with daily functioning. Yeah. Fatigue is pervasive. Probably more than 60% of patients at some point in the disease trajectory does have fatigue. And if we look at fatigue and sleep disorders kind of go hand in hand. And the three big culprits are either medical from the cancer itself or the treatment, underlying health conditions, and we talk a little bit about that, medications, the pain itself can worsen that, but also part of it is the psychosocial effect. How are your mood today? How are your emotions? Do you deal at home, stress in the workplace? Then it is definitely affected by your lifestyle. How much you're able to exercise? Do you have dehydration? And do you have sleep interruptions? So these all affect each other. This insomnia part is basically either with trouble falling or staying asleep, or interrupted sleep. And of course, it results in dysfunction, distress, and we call it, a condition when it occurs more than 3 times a week. and either at least for a month or a chronic one, which is more than 3 months. You don't need sleep studies. Again, almost as common as the fatigue part. And they are oftentimes have to share the same culprits behind them. So here are the medical conditions that we see behind the fatigue and the sleep problems. Sometimes the substance use, although that's thankfully not common in cancer survivors. Underlying heart problem, thyroid disease, lung disease such as sleep apnea can affect that. Many of you who are on active treatment may deal with anemia, that definitely causing fatigue. But think about a tired, a mentally stressful day. That emotional distress definitely will make you feel tired by the end of the day. Medications, sleep aids, pain medications, some nausea medication, and of course, prescription sedatives, antihistamines also affect that. Caffeine could help a little bit, but then has a negative effect on the long term because it kind of interrupts your sleep cycle. And an interesting part that we are aware now that shift work, those who work constantly night shift or interrupt the day and night cycle, patients have more fatigue, but we also know that's actually contribute to cancer development.
Oh,
So what you can do in terms of combat that, in terms of help a little bit. One, that the easy step is keep a little bit of diary. What are the good days? What are the bad days? And then try to move the priorities. They absolutely have to be done early in the morning when you still have energy. Very important. And I'm going to keep coming back to that, that as much as you can keep an exercise, even just a daily little walk will give you not just the muscles going, but also the brain function.
okay.
Massage, acupuncture, anything that take that stress away from your neck muscle, that helps. Yoga, meditation, and then beyond that, consider counseling if you feel like there is overwhelming stress in your life.
Mhm.
Are good in moderation, but if the nap time is more than an hour, that further disrupts the sleep awake cycle. So try to get the naps early in the afternoon and limit to half an hour, definitely not more than an hour. And then ultimately, if nothing helps, talk to your doctors and then see if there's some short-term prescription medication are there for you.
Can I ask a question about massage?
Yes, of course.
Do you need to be mindful of where your cancer is or growing on the massage, or how do you communicate
So
to
for
the
those who deal with, let's say, bone metastases, so live with chronic pain. So if you're worried about, an overly active chiropractic treatment may cause further, you can tell that provider that, hey, I have mid-back or low back problem from my cancer, please, very gentle. I think gentle massage focusing or perhaps acupuncture then will be a better option for you.
What is acupuncture exactly? Can you give me a brief?
Acupuncture is with those tiny micro needles.
Right.
Those stimulate certain energy flowing system between the brain and different organs. And it releases endorphin, it releases certain cytokines that basically relieve that constant muscle tension feeling. It has a good value in pain management, and it also has value in nausea management.
Oh, okay. So yeah. Nausea and pain. Okay.
Nausea, pain,
Okay.
stress relief.
And stress. Okay, got it. All right, thank you. Oh,
Sure.
one other one. On the exercise, every time I call into Compass Oncology, they have the rotating, speeches about different things, and talking about exercise, at least 10, 30 minutes a day, break it up into 3 10s if you have to. What do you feel about that? I mean, or
Start where you can. Of course, some people
anything, huh? Yeah.
pain or sleep problem, even just get through the day is hard, but start small steps.
Yeah. Okay.
That's if you have a few steps at home, start coming up and down 3 times and then 5 times and then They do short walks. So the key is, because, with any exercises, intensity and timing and a total duration. So all of it matters.
Yeah.
And wherever you start, just slowly build on that. Try to find a walking partner. If you have a good friend, a good neighbor, that's always a good,
Right.
that, help each other. I'm gonna show a little bit later of, a true benefit from the cancer perspective, but the message is, it's not just to keep your muscles in good shape. It actually have a good positive feedback on the immune system as well.
That's what I thought. Okay. All right.
Now, up here, I put some new books that I've come across. Michael Singer is New York bestseller author, and he writes a lot about meditation. And some of you might have either read or noticed that, we have this little voice in our brain that constantly telling maybe negative things, that, that you're not good enough, not good at that, not good at something. And this book that he basically with 40 years of active meditation and became an expert, he helps with a very nice and easily readable format to walk you through that, what you can do, how you can shut down that little voice, how you can put that very voice in your brain in a back burner, and help a little bit really open up to the bigger picture that appreciate. So that's his latest book, just came out last year. That's The Right to Living Untethered, but it's very beautiful prose. So here's your question about exercise, and specific about fatigue. So a lot of studies in many different phases of cardiovascular, but also on cancer.
Okay.
And here's, this was an overview. And what they showed that reduces fatigue, not just during, but also after cancer treatment. Aerobic exercise, and that's the exercise that speed up your heart rate. So that little watch and you look at heart rate. So generally what your age, that's supposed to be the basic heart rate. And then we want to push a little bit, at least 20% above that. And that's the goal that you try to get to. And people who did these aerobic exercise for several months, they reported several months later less fatigue. And it's not just the resistance. So if you just go to the gym and work out on those weightlifting, it's good for probably for muscle mass and bone density, but you truly need to have a little bit of speeding up the heart rate. And then again, yoga mind benefit is beneficial for stress reliever, but again, from the actual exercise, you need the heart rate. So breast, prostate, and several other studies now accumulating of benefit of exercise. So start slow, keep baby steps, but keep pushing yourself.
Was there any information on like how often? I know it's going to depend on the person as we build slow, but
well, the messages do a little bit every day. Can you 5 minutes a day?
Yeah.
Can you slowly increase it to 15 minutes? I mean, ideally, this aerobic exercise is 30 minutes, 5 days a week. So that would be an ideal goal, but don't be too stressful if you don't get to that. Yeah, the message is keep moving. Any exercise is better than none. It will help your brain, your feel-good hormone, and it will help your immune system. Now, for those of you who are techies and use smartphones, here is a little app that you can download. It was developed by the Duke University specifically for cancer survivors and named Cancer Distress Coach. And as you see here, it actually helps manage sleep symptoms, anxiety symptoms, concentration. So it gives you little triggers. It gives you mindfulness, relaxation techniques, music. So it's a helpful and highly rated by cancer survivors. I thought, let's share it and try it if you like. Next one kind of goes along with the fatigue is the chemo brain. That's this cognitive dysfunction. Chemo brain is actually a misnomer because it is described in people who never had chemo. I think I would just call it as stress brain, because anybody who had surgery, anybody who even just had the big C in their life, they have stress. So that affects definitely how we multitask. So very, very common. And if you are fatigued, it's definitely more noticeable. If you have been or are on active chemo, that is more noticeable during the treatment. But even if you finish treatment and if you're in a recovery phase or treatment breaks, you may notice, and recovery may take up to a year. And of course, it can affect your daily function. A little background. So if we think of about 2 million years ago, when our ancestors switched from the hunter to the actual, from getter to this hunting lifestyle and meat eater lifestyle. In order to do that, we needed the brain to develop new processes. We need to survive this saber-tooth tigers attack. So we needed our immune system to develop better. So how our brain helped doing that uses this protein called apolipoprotein E. And this apolipoprotein normally has part of metabolizing our lipids and also part of our immune system function. So it allowed us to prevent infection, to help the brain growing to larger size, to help with what is the normal function and the weight of our current brain. On the other hand, that same protein also has part of inflammation. So the message is a little bit of this ApoE is good. It has a good evolutionary function, but too much of it created atherosclerosis. So basically a hardening of our arteries. And similar process happens in dementia, in Alzheimer's dementia. What are the symptoms of cognitive problems, chemo brain? Finding concentration problems, executive function, meaning memory recall, finding the right words, learning new words, learning new materials, and then working with numbers. So those of you who used to multitasking, used to do a lot of things at once, probably noticed that more. And a message, you can still do that, but it will take a little bit more effort, a little bit harder focusing to be able to complete those tasks. Here was a very interesting twin study that I came across. So these were about twin women in their 60s. One had cancer and went through chemotherapy for her cancer. The other twin was healthy without any cancer treatment. And they put them through of increasing mental tasks, and the researchers put them through this so-called functional MRI. So they watched how their brain functioned by they solving these puzzles and increasing difficulty memory tasks. So on the bottom row, you see the twin who did not have any cancer. And then she solved the puzzle and she solved this increased difficult task with just using a smaller portion of her brain. And on the top row is the other twin who been through cancer treatment, and she had this post-chemo treatment. And the message is both of them were able to solve the puzzle and do that, but look how much more portion of the brain of the patient who went through chemo had to mobilize to be able to do the same task. But it also tells us that the brain is very malleable, that it's able to learn new, that other areas can take over. And that's the same area with recovery from a stroke, that other portion of our brain can help and take over tasks. So you can use and train your brain. In terms of vitamins and diet, what showed no benefit these anti-inflammatories, taking estrogen replacement, vitamin E, vitamin B, ginkgo, cholesterol medications, all of it were tried, unfortunately, without any benefit on the memory. What was found, at least modestly protective, is Mediterranean diet. And Mediterranean, I'm pretty sure many of you read about. So it's whole grains, a lot of vegetable, a lot of fruit, exercise again, and then recreational cognitive activity. So again, use your brain, eat healthy, exercise. There are some medications, in my view, relatively little benefit and a lot of side effects. So if they're out there, I don't think there are the actual major benefit. Now, cognitive rehabilitation, those are like, like a stroke rehabilitation when physical therapists, occupational therapists, speech therapists can help. But again, for the techie part, you who like to go to the internet, on the bottom, I'd like you to write these down, lumosity.com, and the other one is cogmed.com. These are actually websites developed specifically for cancer patients, and these are computer games. And we always tell our children and grandchildren, hey, computer brains are not good for your brains. But turns out in these memory problem, in this chemo brain, by using this repetitive task and a little bit more increasing difficulties, that actually retrain the brain to do that faster and reconnect. So this was specifically that starts slow and easy and then with more complex tasks. And I think these are free too, so welcome to try those out and happy playing. Moving on to some chronic pain syndrome. I wrote it for breast cancer, but it's very common for gynecologic or colorectal or lung or many other cancers. Pain can come from the cancer itself and, of course, the treatment modalities. Chemotherapy, the most common one that we live with, peripheral neuropathy. Hormonal therapy, endocrine therapy can cause joint pains, bone aches, and osteoporosis, which can later on cause compression fractures. Radiation can cause some chronic nerve irritation, chest wall syndrome, lymphedema, and of course, surgery-related nerves were cut.
Okay.
The most common of these are the peripheral neuropathy. And think about in this picture, the nerve as like a wiring that covers the nerves that connects our brain to our muscles, to our little mini fibers. So if this wiring is injured, and that could be from the chemo, the radiation, surgery, then it misfires and then give these pain signals to the brain. Even very little injury, very little just touching of the clothes can cause this difficulty. So it could affect either just a sensory, that's that tingling sensation, or in more severe cases, motor weakness, muscle weakness, and impairment of balance. Neuropathy, not just specific for cancer, more common in diabetes, but we've seen liver disease. Keep in mind that B vitamin deficiency, E vitamin deficiency may worsen the neuropathy if someone used alcohol regularly, and then also may come from aging. So any type of pain management is to not necessarily make the pain totally go away, but make it at a bearable level, improve function, and then of course, ensure safety. And then it's a teamwork. It's the patient, it's therapist, it's the doctors, and the whole support system works together. With pain management, it's important not just think about, taking a pain pill, but just as important, all these rehabilitation, physical, occupational, stretching, heat and ice. Here comes the massage and acupuncture again. And then in more severe cases, interventional radiology who can do nerve blocks. But so, and I think I have a slide about that. Let me just go a little bit ahead right here, and then I'll come back. So the pain is this multi-sensory experience. So it's not just, like poke your finger with, or cut your finger and just the pain, but also how their brain processes that. And if you stressed out, if you sad, if you depressed, the same level of pain is magnified in your brain. If you feel lonely, if you feel isolated, if you feel you don't have support, again, the same pain level magnifies. So when we talk about pain management, we need to address the pain, but we also need to address all these psychosocial aspects of that. So with that, I go back a little bit. And here's some interesting data that just was published in the last 2 years. So that's the benefit of radiation. And again, we all feel radiation like, a bad evil because it can cause a lot of things bad. But for some people who have just a few areas of pain, particularly of disease spread in the bone, and this trial, this COMI trial, was up to 5 areas of bone spread, not more than that. So that's the name oligometastatic disease, mean just a few spots. And what they found, if they radiated all of those spots, not only the pain got better, but the survival improved. So it actually confirmed it was a relatively smaller trial, under 100 patients. And now an ongoing larger trial is ongoing up till 10 sites of metastatic disease, that if we control them from the beginning by zapping all these sites, can we improve the survival regardless of other treatment that we're doing? So very interesting concept, and it's evolved of benefit of radiation. Medications, if you think about the nerve type of pain, duloxetine, her name is Cymbalta, is FDA approved for these chemo-related neuropathy. Pain doctor often combine that with other pain medications. There are older generation like amitriptyline, those all tricyclic antihistamines, those work well, but they cause mouth dryness, sedation, urinary retention. So that's not really a great options for many patients. And then other adjunctive medications that some of you might have been taking, gabapentin, pregabalin, and then some topical creams. Unfortunately, most pharmacy now not able to do compounding, but these baclofen, amitriptyline, ketamine, that BAK gel worked for some patients with peripheral neuropathy. Back to the diet part again. Here was some interesting findings about the role of diet. People who take multivitamins, they had less peripheral neuropathy. Those who strictly took vegetarian diet and they were diabetic, that also improved diabetic neuropathy. A larger study, this DELCAP study that I showed on the bottom, showing that whole grains, again, back to the Mediterranean diet concept, whole grains were protective from neuropathy, but interestingly, citrus fruits, so oranges, lemons, made neuropathy worse. A little bit less of those. Further on, the concept of diet and how it affects what the organisms within our body. So if you think about a gut, there are about 3 trillions of microorganisms live in symbiotic way within our gut. Another area that there's a lot of organism is our skin, but the largest one of these microbiome, which is basically all of these bacteria and viruses and some fungi, is in our gut, mostly in the colon. And they have a good role. They help digestion of carbohydrates, and our gut gives them a good protective environment. So it's a nice symbiotic way. What could happen, however, with certain infections, the bad bacteria overgrowth. And we know now in some cancers, for example, the Helicobacter pylori bacterium can cause stomach ulcer, but also in the long term, stomach lymph node cancers. We know the HPV virus. that can be associated with cervical cancer. We know the hepatitis B and hepatitis C virus can cause liver cancer. So there's some direct association with certain bacteria. But we also know that if certain bacteria overgrowth, that can disrupt the immune system. So there's this indirect role of what is the composition of these gut bacteria. They affect our immune system and immune mechanism by directly of up or down regulating some immune cells, or indirectly by causing some cytokine release. And this is a very hot topic now, because what was found in immunotherapy, and first it was described in patients with melanoma, but now they are testing out in other patients, that if patients did not respond well to the immunotherapy, but they got a fecal transplant. And this is now an approved treatment for example, with Clostridium difficile and antibiotic-induced diarrhea treatment. So if fecal transplant from responding people were given to the non-responding patients, they actually responded better to immunotherapy. So very interesting that just by changing the composition of the gut bacteria made it better responding to an actual immunotherapy. So more is coming probably in the next few years. That is a very hotly researched topic now in generally, not just immunotherapy, but in causing and modifying disease in response to the treatment. Moving on to the heart. You may say, okay, what the heart to do with my cancer treatment? Well, first of all, there's a lot of the same risk factors that causing both heart disease and also cancer. The common one, the tobacco, the obesity, the nutrition, alcohol, high blood pressure, hyperlipidemia, but they also affect each other. And of course, many of the cancer treatment increases people for cardiovascular disease. Here's a long list of very common agents that we use in treatment. And in general, the chemotherapies may cause some irreversible damage to the heart muscle. Those of you who have HER2 positive disease, the HER2 targeted therapies generally cause reversible left ventricular dysfunction of the heart muscle. And then the radiation and the hormone blocker medication may affect the risk factors, like can cause increased cholesterol, so may contribute to early cardiovascular disease. And then these latest one, tyrosine kinase inhibitors, immunotherapies, may also affect either the left ventricular function or some autoimmune inflammation. So there is this whole new theme of cardio-oncology when cardiologists are very much involved in cancer patients to minimize the risk for the heart. Can we do that? Can we prevent that or intervene early on? Well, with certain treatment you are getting. Typical is either the certain chemotherapies or HER2 target therapies, then you get regular echocardiograms, regular heart function monitoring. But also notice that if we intervene early on, when a patient does not have that shortness of breath or ankle swelling, and give these ACE inhibitors, beta blockers, statins early on, that perhaps can reverse some of the adverse effect of the treatment. And here, this is a very new that just this last year described this group of diabetic medication. This SGLT inhibitors is basically a group of now approved diabetic medication that turns out not just good for diabetes, but they actually work for heart failure. And more importantly, they found the benefit in non-diabetic patients. So that is another hot topic in this cardio-oncology. And I think we will see a lot of new data coming out in the next couple of years on the benefit of these SGLT inhibitors. So these are these glyphosine, canagliflozin, dapagliflozin. So these new medications that probably will have a role in heart protection in cancer patients. To again, the benefit of exercise. This is a study showing that higher intake of fruits and vegetables, so here's your DASH diet, vegetarian diet, and increased activity reduce the risk of mortality by 30%. And this is irregardless of other treatments. So here is the thing that you can control. Actually, a few words about the fear that we all live with, the fear that, that gut-wrenching feeling when can come in the most unexpected timing. And I'm sure that you all been there. Those trigger points that just something on the news or a friend tell you something. So the first step is have a plan. Feel about it that this is normal. I should not panic about it. This is accepted. This is known. And then talk about it. And what I hear is all of these past hour and all of these support group is help normalizing this feeling that I'm not crazy. I'm not driving myself crazy. This is normal. The other thing you can do is, again, focus on your wellness, that when the strange thought comes in your little voice in your brain, that then do, okay, I'm active. I do everything that I can. And if you still feel overwhelmed, consider counseling. And more importantly, be patient. Start with baby steps and then be very kind to yourself. There's a few things that I've come across. One, I love YouTubes. I think it's free and there's always something good and exciting going on. So Jason Silva put out a couple of series about this. He called it shots of ah. And we all had this ah moment, and we always think about the ah moment that, oh, this is so rare that, you need to go to the Grand Canyon, or you need to go to the Northern Light, or a major thing like witnessing a baby born. But if you think truly, these ah moments are moments that happen every day. You just need to find those little ah moments.
Yeah.
So how can you find that? Where are those ah moments? Well, nature. Nature is definitely healing. People who, and it was actually a research study, I think it was University of Pennsylvania, 2 groups of students. One was sent out just to walk for the benefit of walking and measure their heart rate and, focused on just the exercise part. And the other group was sent out to do the same walk, but they have to be watching out and they have to report back what was something good that they come across during their walk. And they did the same mileage, and the group that came back, who kept open, they felt much better. And again, they did not do anything more strenuous, but they found that little miracle, whether it was a bird, whether it was a little raindrops, it just helped them feeling good and processing. Where else you can find your ah moment? Well, good music, nature, meditation. I put it stand on your head figuratively, but lay down, put your feet up, look at the word from a little bit different angle. Look at maybe there's a different way I can think about it. Be open to look at things from another perspective. It just opens your mind that maybe things are not as bad as I initially imagined. Marcel the Shell with Shoes On. For movie fans, this is a little animation movie. And it was created from first was little YouTube videos that the actress Jenny Slate produced in 2010. And just last year, it made a movie. And Marcel movie, what makes it special, that it's about this little shell, and it's about family, and it's about friends, and it's about loss and healing. And that little movie is surprisingly deep and emotional. And to me, it's therapeutic. Just by watching and you just watch on what emotion it stirs in you, and how those friendships and how those supportive relationships through the hard time. I really advise that you watch this movie. Really a gem. There is such a thing as post-traumatic growth. So it comes from the PTSD literature that, those veterans who were in combat and survived and cope well, they actually grow out of the experience. Such growth can happen for those who any kind of trauma, physical or mental trauma, but the same true for the cancer, that there is this post-traumatic growth. And what it means that there is a vigor, there's an appreciation of life, see the life from a different perspective, prioritize the value. What is really the most important thing in my life now? What do I want to leave behind as a legacy? I grow spiritually. How do I connect with my friends, my family? How do I engage? And that's the other good important thing, that social network. We are all social beings. We are thrive on connecting with people. And that was really, really hard, as you all noticed during COVID. But that's the benefit in longevity literature, that have connections. So yes, diet is important, exercise is important, but the social connections just as important to the mental well-being. Stronger interpersonal relationship, better benefit. So my take-home message tonight is, you are responsible to live your life to the fullest and appreciate what you have, because we tend to look at that glass just helpful, but look at that, how much you, how really full that glass is, and always remember what you've done and be very proud. And with that, thank you, and I'm open for questions.
Thank you.